thanks so much for joining Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we are welcoming Quint Studer, who is the co-founder of Healthcare Plus Solutions Group. Thanks so much for being here.
Well, thank you. Very appreciative.
We just had an amazing interview with Quint, and we're doing our new one question segment. So Apoorv, you have today's one question. Take it away.
So Quint, I guess I can't get enough of asking you questions anyway, so I'm grateful for this one additional question. And, one thing I was paying attention to, because you covered so much during our interview that our audience can go back and listen to. But because we, Stephanie and I particularly, have become big fans of compassion, particularly inspired by Compassionomics. You mentioned Dr. Tresiak. But in the interview itself, you mentioned love, and you mentioned the relationship that really needs to exist, and the caring. And you mentioned empathy as well. A lot of the critical values that are probably all connected to compassion. But I was just wondering if you could also help us tease out, what is it that you think of as compassion? Is it really something different than what you've already discussed, or is there something more that you think we also need to tap into when we're trying to build this, the organization of the future, as you're inspiring us to do?
Well, I think, they hit Dr. Mazzelli and Strzeziak hit it better than I can ever hit it. And I think they put some data behind it. I think empathy is a big part of compassion. I think trying to put yourself in somebody else's place. And I think that's the big part of it. And I just think empathy. And when I look at probably the thing that I've gotten better at the last 3 years since the pandemic is showing empathy, showing understanding, trying to put myself in their spot, not assuming anything. I think forgiveness is a big part of compassion. And one of the things I wrote about maybe a year ago was, organizations all have values, teamwork and generosity and respect. I very rarely have ever seen an organization have forgiveness. And I think in healthcare, people sometimes are afraid to be vulnerable because they're wondering, will I be accepted? Will I be forgiven? So I think forgiven is a missing trait when we think of compassion many times. Do we have a forgiving organization? Look at the impact in healthcare when people got more comfortable reporting near misses. Before that, they wouldn't report it. What's part of near misses reporting? It's forgiveness. It's forgiveness. And I think that's a big part of it. And the third point we talked about is love. June 17th of 2019, one of my best friends passed away, John Meislick. And when he was dying, he said, don't forget to tell people you love them. And, since then, I've been very aggressive in telling people I love them. And it works. It works. And we just do that. I think sometimes healthcare is about emotions, feelings, yet sometimes we don't describe our emotions and feelings. And I remember hearing when you hear a physician tell a patient or a family they love them, that comfort and that trust goes way, way up. So I think empathy, forgiveness, and love are the pieces I put into compassion.
I love that. I love just what you were saying with, Dr. Tresiak, is that it does replenish that. You were so big in our interview that we talked about replenishing, and empathy is something that replenishes, doesn't take away. And you're so right about forgiveness and about love. My daughter was a NICU baby, and I constantly, anytime I keep in touch with them, it's like, I love you guys so much. And I think that does help people keep going. I love, love, love this. So I'm with you.
Well, thank you for the question.
Thank you. And with that, Quint, we'll just have to say we'd be remiss if we didn't say we love you. So thank you for your joy. Thank you for coming on the show. Thank you for inspiring us. Truly mean that from the heart. And hopefully we'll continue to stay connected so we can, potentially be collaborators in trying to figure out how to create more empathy, love, and compassion in the world.
That'd be wonderful. Be honored. Thank you so much.
And thank you all for watching. We'll talk to you soon. Bye-bye.
Bye.